What are the common causes of frequent bladder infections? Frequent bladder infections, also known as recurrent urinary tract infections, can be quite bothersome. So, what causes them? The primary culprit is bacteria entering the urinary tract and bladder. The most common bacteria responsible for these infections is Escherichia coli, often found in the digestive tract. This bacteria can travel to the urethra and bladder, leading to infection. Other bacteria, such as Klebsiella pneumoniae, Staphylococcus saprophyticus, Proteus mirabilis, and Enterococcus species, can also be involved. Several factors can increase the likelihood of experiencing frequent bladder infections. First, female anatomy plays a significant role. Women are more susceptible because their urethra is shorter and located closer to the anus and vagina. This proximity makes it easier for bacteria to reach the bladder. Sexual activity is another contributing factor. Engaging in frequent sexual intercourse, having new sexual partners, or using spermicides and diaphragms can introduce bacteria into the urethra, raising the risk of infection. This phenomenon is sometimes referred to as honeymoon cystitis, which describes UTIs triggered by sexual activity. Hygiene practices also matter. Poor hygiene, such as wiping from back to front after using the bathroom, can transfer bacteria from the anus to the urethra, increasing the risk of infection. Certain medical conditions can further complicate bladder health. Conditions like diabetes mellitus, autoimmune diseases, and neurological disorders can impair the urinary tract's defenses, making individuals more susceptible to infections. Additionally, kidney or bladder stones and spinal cord injuries can contribute to this risk. Postmenopausal changes in women can also lead to more frequent infections. Estrogen deficiency alters the vaginal flora and pH, reducing protective bacteria and increasing infection risk. Other factors, such as urinary retention, incontinence, and structural abnormalities like cystocele, can also play a role. The use of certain contraceptives, particularly spermicides and diaphragms, can disrupt the natural balance of vaginal bacteria, making it easier for harmful bacteria to thrive. A history of urinary tract infections, especially from childhood, can predispose someone to recurrent infections. Anatomical abnormalities, such as urethral diverticulum, can also be contributing factors. While some behaviors, like vaginal douching or wearing tight underwear, have been considered potential causes, evidence does not strongly support them as significant contributors to frequent bladder infections. From the perspective of bladder health, recurrent bladder infections can lead to chronic inflammation of the bladder lining. While most bladder infections are treatable, persistent inflammation may result in changes to the bladder tissue over time. Therefore, it is important to manage recurrent infections promptly to maintain bladder health and reduce any potential long-term risks. In summary, frequent bladder infections arise from a combination of bacterial invasion and individual factors that impair the urinary tract's natural defenses. Effective prevention and treatment involve addressing these risk factors and consulting a healthcare professional when symptoms arise.